Question: A 25-year-old male presents to the emergency department with sudden onset sharp chest pain and dyspnea after a motor vehicle accident. On physical examination, the nurse notes decreased breath sounds and hyperresonance on percussion over the affected lung. The patient's trachea is deviated away from the affected side. Which of the following interventions should the nurse anticipate? A. Administering supplemental oxygen via nasal cannula. B. Initiating immediate chest tube insertion. C. Providing pain medication and reassurance. D. Requesting a chest X-ray to confirm the diagnosis. E. Placing the patient in a high Fowler's position. The correct answer is B. Initiating immediate chest tube insertion. Explanation: the patient's symptoms, including sudden onset sharp chest pain, dyspnea, decreased breath sounds, hyperresonance on percussion, and tracheal deviation, are indicative of a tension pneumothorax. A tension pneumothorax is a life-threatening condition that requires immediate intervention. The insertion of a chest tube is the most appropriate intervention to evacuate the trapped air and restore negative pressure in the pleural space, relieving symptoms and preventing further complications. Question: A 65-year-old male patient, with a history of chronic obstructive pulmonary disease, COPD, is admitted to the hospital with symptoms of pneumonia. The nurse is assessing the patient's respiratory status. Which of the following findings would indicate a complication of pneumonia in this patient? A. Increased breath sounds over the affected lung. B. Decreased tactile fremitus over the affected lung. C. Bilateral breath sounds over the lungs. D. Bronchial breath sounds, bronchi, over the affected lung. The correct answer is D. Bronchial breath sounds over the affected lung. Explanation: in a patient with pneumonia, the affected lung usually exhibits increased breath sounds such as crackles. However, if bronchial breath sounds are heard, it may indicate a complication such as consolidation, where the lung tissue becomes solid due to inflammation and fluid accumulation. This finding suggests a more severe infection and potential obstruction of the airway, requiring further evaluation and intervention. Question: a 42-year-old female patient is diagnosed with community-acquired pneumonia and is prescribed oral antibiotics. The nurse provides discharge teaching to the patient. Which of the following statements by the patient indicates a need for further education? A. I will take my antibiotics with a full glass of water. B. I will complete the full course of antibiotics as prescribed. C. I will avoid drinking alcohol while taking these medications. D. I will monitor my body temperature regularly. E. I will increase my fluid intake to help thin and loosen mucus. The correct answer is C. I will avoid drinking alcohol while taking these medications. Explanation: when a patient is prescribed antibiotics, it is important to inform them about potential drug interactions. Alcohol can interfere with the effectiveness of certain antibiotics, reduce their therapeutic benefits, and may also cause adverse effects. Therefore, patients should be advised to avoid alcohol consumption while taking antibiotics to ensure optimal treatment outcomes. Question: a 78-year-old male patient is admitted to the hospital with pneumonia. The nurse is preparing to administer oxygen therapy to the patient. Which oxygen delivery method would be most appropriate for this patient? A. Nasal cannula. B. Non-rebreather mask. C. Venturi mask. D. Simple face mask. E. Transtracheal catheter. The correct answer is C. Venturi mask. Explanation: oxygen therapy aims to provide an appropriate oxygen concentration to improve oxygenation. In elderly patients with pneumonia, who often have compromised respiratory function, a Venturi mask is the most appropriate choice. This mask delivers precise and controlled oxygen concentrations, making it suitable for patients with varying oxygen requirements. It allows the healthcare provider to adjust the oxygen concentration based on the patient's clinical condition, ensuring accurate delivery of supplemental oxygen while minimizing the risk of oxygen toxicity. Question: A 10-year-old child with a history of asthma is brought to the emergency department with acute respiratory distress. The nurse assesses the child and notes the use of accessory muscles, nasal flaring, and a prolonged expiratory phase. The child's peak expiratory flow rate, PFR, is 50% of the predicted value. Which medication should the nurse anticipate administering first? A. Albuterol via metered-dose inhaler, MDI, with spacer. B. Beclomethasone via dry powder inhaler, DPI. C. Ipratropium bromide via nebulizer. D. Montelukast, singulaire, orally. E. Prednisone orally. The correct answer is A. Albuterol via metered-dose inhaler, MDI, with spacer. Explanation. In acute asthma exacerbations, bronchodilators such as short-acting beta agonists, SABAs, like albuterol are the first-line treatment. Albuterol acts rapidly to relax bronchial smooth muscles, relieving bronchospasm and improving airflow. Administering it via MDI with a spacer facilitates effective drug delivery to the lungs, especially in children who may have difficulty using an inhaler without a spacer. Question: A 30-year-old patient with a diagnosis of asthma is receiving long-term control therapy with an inhaled corticosteroid, ICS. The nurse is providing education about the medication. Which statement by the patient indicates an understanding of the teaching? A. I will rinse my mouth with water after each use to prevent thrush. B. I will use my inhaler as needed during an asthma attack. C. I will stop taking the medication once my symptoms improve. D. I will take the medication on an empty stomach for better absorption. E. I will switch to a different brand of inhaler if I experience any side effects. Explanation. The correct answer is A. I will rinse my mouth with water after each use to prevent thrush. Inhaled corticosteroids, ICS, can cause oropharyngeal candidiasis, thrush, as a side effect. Rinsing the mouth with water after each use helps to minimize the risk of developing thrush by reducing the residual corticosteroid deposition in the oral cavity. This is an important self-care measure for patients on long-term ICS therapy to maintain oral health. Question: A 50-year-old patient with asthma is prescribed a combination inhaler containing a long-acting beta agonist and an inhaled corticosteroid, ICS. The nurse provides education on the proper use of the inhaler. Which instruction should the nurse prioritize? A. Rinse your mouth with water after each use. B. Take a deep breath and hold it for 10 seconds after inhaling. C. Prime the inhaler by shaking it vigorously before each use. D. Use a spacer device to improve drug delivery to your lungs. E. Clean the inhaler with warm soapy water once a week. Explanation. The correct answer is A. Rinse your mouth with water after each use. Combination inhalers containing both long-acting beta agonist and ICS have an increased risk of oral thrush due to the corticosteroid component. Rinsing the mouth with water after each use helps to prevent the development of thrush. This instruction is crucial to minimize the risk of a common side effect associated with combination inhaler therapy and promote optimal patient outcomes. Question: A 40-year-old patient presents to the clinic with a persistent cough that has lasted for 3 weeks. The cough is productive with yellowish-green sputum and is accompanied by mild chest discomfort. The patient denies any history of smoking. Which of the following interventions is most appropriate for managing the patient's symptoms? A. Administering an antibiotic course. B. Prescribing an inhaled corticosteroid. C. Recommending over-the-counter cough suppressants. D. Encouraging increased fluid intake. E. Scheduling a chest X-ray. Explanation. The correct answer is D. Encouraging increased fluid intake. The patient's symptoms, including a productive cough with yellowish-green sputum, are suggestive of acute bronchitis, which is typically caused by a viral infection. Antibiotics are not indicated in uncomplicated cases of acute bronchitis, as it is usually self-limiting and resolves without antimicrobial therapy. Inhaled corticosteroids are not recommended as a first-line treatment for acute bronchitis. Over-the-counter cough suppressants may not be effective in expelling secretions and could potentially suppress the cough reflex. Encouraging increased fluid intake helps to hydrate the airways, thin respiratory secretions, and facilitate their expectoration. Question: A 55-year-old male patient, with a history of chronic bronchitis presents to the emergency department with increased shortness of breath, wheezing, and cyanosis. The nurse suspects an acute exacerbation of chronic bronchitis. Which of the following interventions should be the nurse's priority? A. Administering supplemental oxygen. B. Performing a pulmonary function test. C. Initiating antibiotic therapy. D. Administering a short-acting bronchodilator. E. Requesting a chest X-ray. Explanation. The correct answer is A. Administering supplemental oxygen. In an acute exacerbation of chronic bronchitis, there is a decrease in oxygen saturation and increased work of breathing. Administering supplemental oxygen is a priority intervention to improve oxygenation and relieve respiratory distress. Pulmonary function tests and chest X-rays may provide additional diagnostic information but are not the immediate priority in managing an acute exacerbation. Antibiotic therapy may be necessary if there is evidence of a bacterial infection. Administering a short-acting bronchodilator helps relieve bronchospasm and improve airflow. Question: A 30-year-old female patient is diagnosed with acute bronchitis and prescribed a short course of oral corticosteroids. The patient expresses concerns about potential side effects. Which response by the nurse is most appropriate? A. Oral corticosteroids are generally safe and have minimal side effects. B. Side effects are rare with short-term use of oral corticosteroids. C. You may experience temporary side effects such as increased appetite or difficulty sleeping. D. There are no side effects associated with oral corticosteroid use. E. Side effects are only common when corticosteroids are used for long periods. The correct answer is C. You may experience temporary side effects such as increased appetite or difficulty sleeping. Explanation. Oral corticosteroids, even when used for a short duration, can have potential side effects. These can include increased appetite, mood changes, difficulty sleeping, and temporary fluid retention. It is important for the nurse to provide accurate information to the patient, acknowledging the possible side effects while reassuring that they are usually temporary and resolve once the medication is discontinued. This empowers the patient to make informed decisions and manage their expectations.